Since 2007, I've had the honor of serving as the health officer here in Cambridge. So as the Chief Public Health Officer overseeing the programming for a city of over 100,000 residents, it's been an incredible opportunity to demonstrate a number of our public health functions that prevent the spread of disease or injury, help to promote healthier lifestyles across the city, but more importantly and most importantly, working with our community stakeholders to protect the community at large. And so it's been great over time working with our community health and wellness programs, looking at our activities tied into environmental health or emergency preparedness, but really understanding all the nuances and the services that are provided by half our staff who are nurses by training. I mentioned earlier about just the value of my work-related experiences, but just as valuable for me has been these other training opportunities that have prepared me and built my skills as a health officer. And so the various fellowships and training opportunities, not just locally, but also nationally. So the Public Health Leadership Institute and the training offered there, the Kellogg Fellowship for Emerging Leaders in Public Health, a lot of the work that I did as my project as a graduate student with the Schweitzer Fellows Program, but even the eye-opening experience as an extern with the Commission Corps. All of these experiences, in addition to just some sound advice from mentors, both near and far, mentors who have served as health commissioners, hospital administrators, or community advocates who helped me to recognize the proverbial hot stoves in community, but also to refine my craft and understanding why it's important to build on each skill and apply these learnings. Depending on the day, there are different issues that pop up, different fires that we have to put out. And so whether it's a phone call from a city councilor or an elected official, or it's a foodborne or disease outbreak, or even just a community partner who has a time-sensitive request, a lot of what we find day to day is that we have to be available to respond to the call. And so if the state calls or a funder calls or an elected official calls, we have to be there to respond. And I'd say there are a couple answers to that. Day to day, given the requirements for local public health and protecting the health of our municipality, it's having staff, having adequate staff that don't burn out, because quite frankly, what we've seen over the course of the last few years is that the support made available for local public health has been dwindling, whether it's increased competition because of grants or just the fact that tax levies or other financing mechanisms in a particular municipality or county aren't available to support the efforts of local public health. So staff burnout is a very real challenge. On the flip side, I have the incredible opportunity of working with a team that's just phenomenal. So their passion shows daily. They're a very talented and dedicated crew. It makes my day to be able to walk into the department and know that they're ready to hit the streets or do whatever it is that we need to do to protect the health and well-being of our residents. And so for me, that makes my day. Beyond that, we are a part of a city and a system that has been very supportive of our work. There's a unique interface between the Cambridge Health Alliance and the City of Cambridge in doing our public health work. And because of the support around the city and because of the support that we get through funders and with our state level partners, we've been able to benefit, we think, in a great way in demonstrating the models that work and in applying these practices and sharing them to not only the local community but beyond.